Breaking down mortality by age groups reveals where death strikes hardest in Lesotho. The statistics for children paint the darkest picture of all. Under 5 mortality reached 117 deaths per 1,000 live births in 2022, according to recent data tracking. This means that more than 1 in every 10 children born in Lesotho will not survive to their 5th birthday. The rate has shown little improvement over recent years, reflecting the compound impact of malnutrition, disease, and limited healthcare access that defines childhood in many parts of the country. Infant mortality tells an equally devastating story, with 54.6 deaths per 1,000 live births, significantly higher than regional averages. The COVID-19 pandemic created disruptions that continue to ripple through Lesotho's health statistics today. HIV treatment programs that had shown steady progress throughout the 2010s suddenly faced massive interruptions when lockdowns and supply chain problems hit in 2020 and 2021. The pandemic caused widespread service disruptions across clinics, slowing down viral suppression progress that had taken years to achieve. This disruption reversed nearly a decade of hard-won gains in HIV management, meaning thousands more people are now living with detectable HIV levels that increase both transmission risk and personal health dangers. Gender differences in life expectancy tell their own story of how death affects men and women differently in Lesotho. Women can expect to live to 56.8 years on average, while men face a life expectancy of just 51.9 years. This nearly 5-year gap reflects the different ways that HIV, violence, and dangerous working conditions impact each gender. Men more frequently work in the hazardous mining industry or migrate to South Africa for employment, exposing them to industrial accidents and infectious diseases. They also seek medical care less frequently and often ignore symptoms until conditions become critical. Women face their own unique risks through gender-based violence and complications during pregnancy and childbirth, but they generally access healthcare services more consistently than men. These mortality statistics translate into family structures that would be unrecognizable in most other countries. The average child in Lesotho will lose at least one parent before reaching adulthood, with many children becoming complete orphans while still in primary school. Extended family networks that traditionally cared for orphan children are themselves stretched beyond capacity as adult mortality continues climbing. Grandparents in their 60s routinely find themselves caring for multiple grandchildren whose parents have died, creating households where the elderly struggle to support the very young without any working-age adults to provide income or physical assistance. Recent analysis from the World Bank reveals that Lesotho's overall mortality rate now exceeds the Sub-Saharan African average by 40%. This gap represents tens of thousands of deaths that occur in Lesotho, but would be prevented if the country simply matched regional norms for healthcare access and disease management. The mortality rate disparity affects every age group, but hits hardest among adults aged 25 to 45, the demographic that should represent the economic backbone of any developing nation. Geographic location within Lesotho determines survival chances almost as much as age or gender. Life expectancy in the capital city of Maseru reaches 61 years, a figure that approaches respectability by regional standards. However, this urban advantage disappears rapidly as you move into the highland districts. Rural mountain communities report life expectancies as low as 48 years, creating a 13-year survival gap based purely on where someone happens to live. The highland districts of Mokotlong and Thobotsika consistently record the lowest life expectancy figures, with some villages reporting that half of all adults die before age 50. The demographic collapse creates economic consequences that threaten the country's future viability. Lesotho's working-age population between 18 and 60 is shrinking faster than any other country in the world. Current projections show this critical demographic declining by 2.3% annually, a rate that makes long-term economic planning nearly impossible. The textile factories that once provided employment for tens of thousands of workers now struggle to maintain adequate staffing levels as their workforce literally dies away. Current mortality trends suggest even worse outcomes ahead if nothing changes dramatically. Mathematical projections based on existing death rates indicate that life expectancy could drop below 50 years by 2030, pushing Lesotho into territory that would make it the shortest-lived nation in recorded human history. The trajectory appears almost inevitable unless the multiple crises driving early death can be addressed simultaneously and aggressively.